This is Kim and Kim, and welcome back to Ask Mom's podcast. We are not professionals, but we can share our experience and remind you that
You're awesome.
And if you feel you need professional support, please reach out to a qualified medical expert. So we are talking all things motherhood, the good, the tough, and everything in between. And first off, we'd like to give a big shout out to Abby.
Yes, Abby.
Abby's a listener that suggested we speak about menopause. And we've got a special guest, Dr. Tina, who is a medical doctor, our friend, and a mom of 3,
Yes.
and a grandmother.
Yes. Since the last time, your
Yes,
grandmother
that's right.
now.
And we are so excited you're here, Dr. Tina.
Yay.
And we want to thank you for taking the time to share your knowledge and experience with us. And remember, when we're young, right, we get that talk about when we get our periods, but we don't get the talk about when we're about to stop our periods. So,
Right, for sure. And men, please don't run away. You might find this interesting and a way to understand what your wives, your sisters, mothers, other females in your life might be going through. And trust me, after this, you might want to run out and buy them some flowers
absolutely.
or take them to dinner. At the very least, know when to run. Kidding.
Or just keep
Kidding,
quiet.
but not
Keep
kidding.
quiet.
Yeah, or keep quiet. Yeah. So, Dr. Tina, thank you for joining us again with
My
another
pleasure.
big topic.
Yeah.
And with everyone being able to Google information, we thought it might be helpful if you would offer us a general overview of what menopause is and maybe answer a few of the most common questions women have. Although I'm sure you're going to cover most of it anyway. But yeah.
And
So-
questions we don't even know we have. Right?
Yeah.
Yeah, exactly.
Yeah. So what is menopause?
So menopause is actually the anniversary of not having a period for a year. So
Happy anniversary.
when you reach that anniversary date, then you're told that you've entered menopause. Yes.
So I learned something in the first 5 seconds.
There you
I
go.
didn't know there was an anniversary. So if you were spotting,
Yes. Which it can be the norm for years leading up to the menopause,
okay,
that we will have these irregular cycles.
okay,
And we call that the climacteric. It's usually a 10-year period leading up to the menopause.
okay,
But menopause is actually absence of periods for a year. You've become menopausal.
menopause.
And is that perimenopause?
That
10 years?
the lead up to it, correct?
So that other word you said was
Yeah.
perimenopause.
Perimenopause.
Okay.
Exactly.
So that's when you're still spotting
and still ovulating and still having enough estrogen that you tend not to have symptoms.
okay. So good question then. So if you are having spotty periods, can you still get pregnant?
Yes. Yeah. So as long as you're menstruating,
Ladies, pay attention.
you can still get pregnant. That's right. Mm-hmm.
Okay,
So the average age for menopause in Canada is 52.
really?
And if you have premature ovarian failure, that's a woman who loses her periods usually before the age of 40. So
Okay,
that would be a premature menopause.
okay. So at that age, would you still get the symptoms?
Yes.
Or it's just your period stops?
Same thing. They would get their symptoms because
Okay.
it would be the same issue that they're not ovulating, the estrogen level has dropped, and
Okay.
they would be menopausal.
Wow.
Mm-hmm.
Holy. So what about older people? So I was, not to overshare, but I was 60. So does that mean anything? Or
Not really. I mean, we tend to follow what perhaps our family members have done,
right.
which is interesting because often our family members don't discuss this with us, as you guys know.
Yeah.
But what's interesting is that a woman who starts her period at a younger age tends to have her periods longer than a woman who starts older. So it's not really fair, is it?
No, not at all.
No, I agree. I totally agree.
Holy.
Yeah.
Wow.
So as far as the symptoms, I think the most common one that women, 80% of women going through menopause will talk about experiencing are hot flashes.
Oh.
And it's brought on by that drop in estrogen level,
Okay.
triggering this flush that usually occurs over our face, our neck, our upper body.
Okay.
And it can go on for about 1 to 5 minutes and be associated with sweating or feeling chilled, and can be associated with palpitations or even a little bit of anxiety.
So chills, eh?
Some people will feel really chilled.
Oh, I didn't know that. Really?
Yeah.
I didn't know that. I thought hot flash was unbearable. You're sweating through your clothes and all. I didn't know you can get chills too.
Yeah,
Wow.
We are complicated, aren't we?
we are. Yeah, and they can go on for a while. Like the average woman tends to have them for about 5 years. So like a third of women could have them over 10.
Oh, Jesus.
Yeah.
So,
Hang in there, girls.
Yeah.
no kidding. So how often, on average, because I know obviously people will be different, but on average, how many hot flashes would a woman have, like in a day, or
I don't. I think
is
that
there
varies.
any measurement of that?
No, I think that varies individual to individual. There's certain things that might be triggering that, with respect to a change in your core body temperature triggering
Okay.
the hot flashing. But no, I don't think that anyone's really given us a number as to the number of events to expect per day.
Okay.
And a lot of women seem to have them at night, too.
Yes, yeah. So, and which is very disruptive, right? Because you're having your sleep disrupted as you're whipping off the covers, and then you get cold and you're putting them back on.
Right.
So we often see women will be quite fatigued because of that sleep disruption. They have difficulty going back to sleep, and it creates issues as far as increased risk of depression and mood changes.
So be careful, ladies.
Yeah,
Be careful. Take care of yourself.
Exactly.
So, any suggestion on what to do to ease some of those symptoms, like the hot flash symptoms?
There are lots of things that we're more aware of now, and I think this dialogue that we're having, this is becoming more the norm for us to be talking about. Women do go through menopause, and even workplaces are now becoming more friendly to people in that age group that are experiencing this, right? As far as the temperature that women are working in, wearing layers so that if you are having hot flashes that you can strip down a few layers.
Yeah.
And fans and cooling have been shown to help. There are other remedies that the best remedy really is hormone replacement. So hormonal therapy, putting estrogen back into your body, is the most effective to turning off hot flashing because it is related to that low estrogen or lack of estrogen.
So when would people consider something like that?
I think when women go through menopause are really symptomatic, and it's very disruptive to their lives, I think they would very much benefit from having hormone replacement.
Yeah, so they should go to their doctor
and have that discussion.
Yeah.
Interestingly, back in 2000, the Women's Health Initiative came out, which was a big study that looked at the risks and benefits of hormone replacement. And many women threw away their hormone replacement therapy upon publication of that study. There are risks involved with hormone replacement as far as increasing our risk of cardiovascular events such as heart attacks and strokes, as well as increasing estrogen promoted cancers. But I think what we've learned in doing a review of the data that was part of that study is that taking hormone replacement in that initial period post-menopausal, so women in their 50s, so under age 60, and people taking it for less than 10 years, we really are probably outweighing the risks with those benefits that those women are going to experience. So that's one thing that we're going back
something
towards.
You'd have to take forever.
Correct. Yeah.
So it's just through the symptomatic period.
Exactly, to get them through that.
And
exactly.
And then you would come off it.
Right.
Okay.
Yeah. What about estrogen type foods? soys, things like that. Yeah.
So where I look for guidance on giving patients advice is we have this North American Menopause Society, which is a society of clinicians, researchers, and they give us sort of the best data-backed evidence-based medicine. And when we look at supplements, yes, you're right. Soy is probably one of the most consumed isoflavone, which is it's a family of foods that do have estrogen promoting, so agonist and estrogen inhibiting properties, which is interesting.
Oh.
But when they've looked at the actual benefits of soy-based milk and soy-based foods, there actually isn't sufficient evidence to really say that it's beneficial. And the same with, we used to give advice about black cohosh and red clover, and I've seen milk thistle and chaseberry and other things that are, again, supposed to be promoting estrogen levels. But there really isn't strong evidence to support that supplementation is going to make a difference in our hot flashing.
Good to know.
Yeah. But I mean, it wouldn't hurt if someone tried.
That's,
You know, just don't be surprised if it doesn't work.
Exactly.
basically.
Yeah.
Don't be disappointed.
Yeah.
So, okay.
So what we found, there's evidence to support that if you can maintain a good body weight, it does help. So weight loss does, in fact, help hot flashing as far as severity and frequency.
Okay.
We do find that when people go through the change or menopause, that we tend to put on weight. We tend to see it in more around our midsection as far as a redistribution of where we carry our weight. So definitely trying to have that, 150 minutes of moderate activity each week would be very beneficial as far as trying to help your estrogen levels.
You know what I think would help is aqua fitness, because you get the cooling from the water.
Yeah, while you're also pushing
as you're
it and
talking,
sweating.
I'm building myself up into feeling a hot flash. But, no. But I'm thinking, if I'm feeling that way, and I know that I have to do a little bit of exercise, or it's good for me, not that I have to.
Yeah.
That sensation of the cool water along with...
would be a good fit.
Yeah.
Absolutely.
Okay.
I guess one size doesn't fit all, right? Like whatever works for you and you enjoy doing.
Can I just ask another question about periods?
Yeah.
So are we good with the hot flashes? Okay, sorry. Is there, I think I know the answer already, but I have to ask, is there a way for women to know when it's safe to stop using a tampon or a pad? You know what I mean? So when you're starting to slow down and your periods aren't regular, and it's like, when am I comfortable that I don't have to use that anymore?
Like you're not
get
as
that
heavy
question.
flow?
No, or at all, right? So your periods are slowing down or they've stopped.
Oh, so you don't want to have a surprise kind of thing?
Exactly.
I don't know that you know until you get there, right?
I guess just keep them in your purse.
Yeah,
in
just in
case.
case.
And
Yeah.
When you get that
'Cause
little
you
sense
see
of-
women who say, I've got 6 months, and whoa, here it is again,
I
right?
know.
You think that you're
Yeah.
finally done, and you're not.
Yeah.
That's so true. It's such a tease. It's like, yes, it's been
Yeah.
9 months, and then
Yeah,
Yeah.
exactly.
start day one.
But you know what? I think that's also good for people to know, that if you went 6 months, it is possible that you could have one.
Absolutely.
Because people might think, there's something wrong with
Oh,
me
yeah.
because I didn't have it, and then all of a sudden I have it again.
Yeah, don't get rid of your products.
No.
Yeah, you're right. You'll get caught.
Yeah.
Sorry, folks. I thought we'd have an easy answer, but there isn't one. There isn't one for that.
Yeah.
Oh. So the other things we were going to talk about, Kim, hair loss.
Thinning hair,
So that
things
was a
like
big one that came up to us.
We've got a friend who's taking the hormone replacement therapy, and it has done wonders for her.
Really, eh?
It
For hair
has.
loss and
She's got 0 wrinkles too. Her face is like, the skin is beautiful, and
Yeah, I hear that from many patients who are hormone replacement, that they appreciate those benefits
Yes.
of being on hormone replacement.
oh really?
yeah, yeah.
So just like men, like it's often that hormonal imbalance that causes that hair loss, right? So when we lose the estrogen, we have more androgen or testosterone in our bodies, and that's what drives that hair loss. It also puts hairs in places you don't really want it,
Well, I was
like on
gonna
your
say-
chin and on your
I was
face.
going to
right?
say,
Yeah.
why can't it stay on my head and fall out my
Yeah.
armpit? I know. But it's, and it's the interesting hair that shows, and it grows so fast, right? And it's so embarrassing. Like I would be at dinner or something. My husband says, "Can I say something?" And I'm like, "Okay." And he goes, "Well, there's like this hair sticking out of your chin." And when I touch it, it's like half an inch long. It's like, where the heck did that come from?
Yeah.
Right?
You feel really
Oh.
special.
So it's not only me, right?
No. Oh my gosh, no.
No.
And then mustaches, like everything.
Yeah.
Tweezers
Yeah.
are our friends,
Yeah.
Yes.
right?
Yeah. All these things.
Yeah.
Yeah.
So do things like Rogaine and things like that work?
Yes, they do actually. You'll see that they'll be in the different pharmacies and other places that will say Rogaine for women. So,
Okay.
yeah.
So it does work.
Minoxidil does help promote hair growth. It takes a while, but it will help get
Okay.
you back some hair.
And is it harmful?
Not that I've come across any evidence to say that it's harmful.
Okay. So there's another very interesting question. It's about vaginal atrophy.
Mm-hmm.
I know you know that it's thinning, drying, and inflammation of the vaginal walls.
Mm-hmm.
And this,
Good for you.
right?
Look at you.
I know. I prepared. I didn't want to let Dr. Tina down. Any suggestions for women who experience this uncomfortable symptom? A listener also mentioned that sex hurts.
Okay. So this is very common as well. We call it genitourinary symptoms of menopause. So it refers to the genital region as well as our urinary tracts. So there are estrogen receptors in our urethra, so we benefit from estrogen, both our bladder and our urethra, as well as our vaginal tissues, as well as our vulva or area of our perineum that can get quite thin and
So
lack
quite-
of
quite
moisture. So your labia or the lips of our
Yeah.
perineum can actually atrophy. Just means shrinkage. That's what it means.
Really?
It means having less mass, and that's what we see is that our labia will become more shrink in size, and the lining of the vagina gets thin, and that's what causes that. It's a lack of lubrication, inflammation. Sometimes, as you mentioned, intercourse can be very uncomfortable. The vagina will actually, with this atrophy or shrinkage, we actually lose capacity in the vagina. So if we stop having intercourse because it hurts, we'll actually see even further shrinkage. So it becomes painful to just restart having intercourse again.
That's kind of a vicious circle.
It is. So we want to add some lubrication back in there. Topical or vaginal estrogen works to help the local tissues. So there are some women who it's contraindicated for them to take hormone replacement, but they can still use low-dose vaginal estrogen because it doesn't get absorbed in the bloodstream to the same degree as taking a regular hormone replacement. And it can provide some increased lubrication. So we tell women to use water-based lubricants during intercourse, like KY jelly. There are also products that are on the market that are polymers. And what these things do is they draw water in from the local tissues and keep it there at the surface of the vaginal lining. So one is called Replens, and there are other vaginal lubricants that are on the market that can help you have more lubrication, hence less discomfort down below, because it's a real thing. And the other thing we see is that, getting back to the bladder and the urethra, women will have urinary symptoms where they'll be up more often at nighttime urinating. They'll find that they have that urgency. They can't put it off like they used to when they have to hit the washroom. And they might have some discomfort when they're urinating as well. So, so overactive bladder is definitely something that occurs, again, because of that lack of estrogen.
So I have an icky question.
It's not icky. This is just life.
So with Matthew's closing his ears. So with the wall getting thinner in the vagina,
Yes.
if you don't do anything and you have sex, can it tear?
Yes, it can. And it can bleed. And it can be very uncomfortable. Absolutely.
Would it repair? Like, is it dangerous for that to happen?
No,
or-
it would repair. But I think it's so unpleasant to experience that, right? And then what happens is the couple will be skittish to try to have intercourse again because your partner doesn't want to see you in pain, and you don't want to experience that pain. So it's hard for you to feel in the moment turned on when you know that it's going to cause pain. So you have to take those steps to ensure that it's a pleasurable experience, right?
So make sure you
And
use lubricant at the very least.
And it's one of those, if you don't use it, you lose it, right? So that capacity in the vagina will diminish over time if you're not having intercourse or self-pleasuring and being able to introduce things.
Smaller?
Exactly. And it won't allow penetration without a lot of pain.
Menopause is not for sissies.
That's right.
It's not like we have a choice.
You're right.
Wow. Okay, so lubrication, and whether over the counter, and if you're looking at any type of estrogen replacement, to maybe talk to your doctor
Absolutely.
to know what dosage is right for you.
Exactly. And also if there's any contraindications that you shouldn't be taking it.
We did talk just touched on supplements. Are there any you recommend we take, or any that you recommend we avoid during menopause?
Supplements, you mean?
Like vitamin,
Vitamins
herbal supplements, any things like that?
Yeah, nothing that really. Now, a few things I'd like to mention. At the time of menopause, that's when our bones actually take a hit. Our bones do really well with estrogen, and when our estrogen supply gets cut off, that's the most rapid rate of bone loss that we're going to have in our lifetime, is in that first few years after the menopause.
Okay.
So taking calcium and vitamin D and being active is a way to help promote your bone health. Eventually, that steep decline in your bone mass starts to level off, and you lose a little bit each year at a much slower rate. But we do see an accelerated rate of bone loss around the menopause.
Okay.
So it's really important to think about bone health, especially if we have family history of osteoporosis, or we're smokers and have other increased risk factors for our bones.
Okay.
Vitamin C
But as
and
far as-
vitamin D.
Yeah.
Okay.
No, vitamin D and calcium.
Oh, vitamin D and calcium. Sorry.
They're the building blocks of
And then
maintaining your bones.
With vitamin D, for your body to absorb it the best, do you not have to have vitamin K now?
Yeah, I haven't come across that. I know that
Okay.
there are people out there that really promote that, but I haven't actually seen any research on that.
Okay, because things change almost weekly if you read the news.
It's
and
true.
It's like, oh,
Gosh,
no,
I know.
It's true.
I should drink coffee, and then nope, no coffee. And
Yeah, you're right.
Have butter. Nope, don't have butter. And then even things like if you're not digesting your proteins as well, like meats and things like that, you're going to be low on the B12s and stuff. So do I supplement with that? And, it's...
What they did find interesting, when we're talking about meat and that, is that vegetarian or vegan diets actually have less hot flushing than women who have higher fat, higher meat content diets.
No way.
Yeah.
Oh,
So
wow.
actually eating more, vegetables and fruits and avoiding that high sugary, high fat content diet will actually help decrease your frequency of hot flushing.
And that kind of lines up with you're talking about keeping your weight,
Exactly. If you could. Yeah.
keeping your weight balanced, right?
Yeah.
So I wonder if it's more your weight is lower, or if it's the veggies and the fruits and the beans and the rices and things like that, rather than the...
Yeah, it's hard to tease out. It really is. Yeah.
We are very complicated.
Harder than the mashed potatoes and the chocolate bar after.
Yes, yes.
Oh my God, there's so many questions.
I know.
Unreasonable mood swings.
Yes.
What's that?
What are you saying?
Yeah. There's no such thing.
Matthew, get in here right now.
Where's our coffees?
Yeah. No. Again, that is that hormonal upset that happens, right? That sets us up for these mood swings and these mood changes. And again, that sleep disruption, that insomnia, an increased risk of depression that we see that as women go through these.
So is that a chemical imbalance in your brain or something, or it's like what?
Or from this lack of sleep can set that off? Or?
Yeah, I think it's really hard to really put together.
To pinpoint it,
yeah,
eh?
Exactly.
It's just all part of the symptoms.
Yeah, and that brain fog that women report as they go through,
Yes.
right? They will, they'll say, oh, I can't remember people's names, or, could I be, having some early dementia because I don't recall things like I used to.
Right.
And that's all part and parcel of the hormonal changes that are happening.
Well, thank you so much for saying that, because I can guarantee you there's a ton of women out there think that.
Just like when you're pregnant.
Yeah,
and it's
that's
one
right.
of those,
Pregnancy brain.
Yeah,
exactly.
And it's one of those things that you really don't want to say out loud sometimes, because A, you might be afraid that it's real, like something's happening to me, or B, you just don't talk about it.
It's just, life.
It's part of your life.
And then the other ones, oh, what? Oh, you don't talk about that.
Yeah.
That's not for ladies to talk about. It's like, well, okay, then who?
Yeah, who do you turn to?
Who do you turn
Yes,
to?
yes.
Right.
Let's do the girl power thing and talk. We'll help each other.
Yeah.
And it is empowering to know. Like, knowledge is power. Right?
Exactly.
So, yeah.
Yes.
Yeah.
Wow.
Ask questions.
And I love it that some of the movie stars are now bringing forth their concerns too, because they're getting at that age, and it's like, wow, thank you for bringing it out there, right?
Mm-hmm. Exactly.
So I have a question about, so women that took extra hormone treatments to try to have a baby, does that affect, like, is there any, what do I want to say?
Does it affect it at all? Like all the hormonal?
Yeah, like, does it bring it on earlier?
Does it change
make
anything?
anything different?
No, not that
No.
I've come across.
Okay.
No.
Okay, so that's good to know too, because I know that, people that are having trouble to have a baby, I remember years ago I had to go through fertility treatments, and they told me that my menopause time or whatever could be a lot harsher or whatever. And I just wanted to ask you, first of all, so thanks for clearing that up. And I also want to say, I went through tons of treatments, and I don't even really recollect, other than one time, having a hot flash.
And there are people who have very, very mild symptoms, and then there are others who just,
They're
really
unbearable.
suffer. Yeah.
So it's real, people.
Yeah.
Especially you men out there. It's real.
Yeah. And
Yeah, we're not-
it's an individual experience, right? You can't really say everybody's going to go through the same thing.
No, and nobody wants to feel like this. So, give each other a break.
Yeah,
And
exactly.
if somebody's acting a little not like themselves, just, give them a little gentle pat on the back, or maybe don't touch them, but,
Depending who it's
yeah.
Run.
But it's, does it also increase, you did say anxiety too, from maybe lack of sleep, but is it just lack of sleep, or is this another one of those lack of sleep and hormones too? Does estrogen also affect our calm?
Exactly.
We need our estrogen
We
back.
do.
Yeah.
Yeah. Yeah. And at least, if you're taking estrogen, the other thing I want to say is if you have a uterus, you need to take progesterone as well. Like, it's not just estrogen for a woman who has a uterus. If you've had a hysterectomy, you can just take estrogen supplementation on its own. Mm-hmm. But it's that combination, estrogen and progesterone, that is part of the traditional hormone replacement that we look at in a woman with a uterus still.
So we're also losing our progesterone when we go through menopause?
So the reason we supplement people with progesterone is that estrogen on its own can really promote a buildup of the lining of the uterus, and to the point where it can promote endometrial cancer, which is a cancer in that lining. So to keep that in check, we have to take progesterone so that lining doesn't build up. Mm-hmm. So anyone who has a uterus has to take both. Mm-hmm. Estrogen and progesterone.
Well, I think you're answering my next comment, because, like, we go online and research things all the time.
Yeah.
So I heard, I looked at common questions that women had, and some people were saying that through a blood test you can tell when you're in menopause, and they said most medical tests really aren't needed to determine if you have menopause, right? But sometimes your healthcare professional suggests blood tests just to check on your hormone levels, which is exactly what you're talking about right now, to treat you most effectively. Right.
Well, I think the interesting case is the woman who's had a hysterectomy, right? So she hasn't had periods since she had that performed.
Right.
So she wants to know, am I there? Am I at the menopause?
Right.
So what we would do is order a blood test that looks at a hormone that's produced from our pituitary gland that sends a signal down to the ovaries to say, hey, it's time to ovulate, which we call the follicular stimulating hormone. Okay. And that will go through the roof when you're in the menopause because your pituitary gland still is looking for you to ovulate, doesn't realize that your ovaries have shut down, and just says, hey, I'm just going to send you more stimulating hormone. You're not listening to me. So when we see a very elevated FSH, or follicular stimulating hormone, we can pretty much tell that woman that she is menopausal.
Okay. And because people's levels are all going to be different.
Correct. It's not really across the board test that we routinely order because it's based on that 1 year without periods that we tell people that they've finally reached that menopause.
And then does your pituitary gland, sorry, Kim?
No.
Does it start to kind of calm down after a while? Like when it keeps looking, does it just kind of go, okay, it's never happening?
That's a good question. I don't know. I think it just still stays sending a signal saying, hey, you need to ovulate.
It's constantly looking for the Wi-Fi signal. And Yeah.
Huh. Wi-Fi signal.
Right. Well, you know how your phone
cool.
is always searching, right?
Yeah.
And it's like, oh, maybe that's our pituitary is looking too.
That's cool. You know what I'm impressed with? That Dr. Tina knows all this stuff right off the top of her head.
Oh, yeah.
Oh, my God.
Well, it's a very routine discussion, right?
I have to research the questions, never mind the answers. Holy smokes.
I think you're just super brilliant, too.
Oh, okay.
Yeah.
Well,
she has nothing in front of her. This is just all coming right out of her.
No, yeah, exactly.
all right.
Yeah, exactly. Yeah, take the win.
I'll take
Yes,
it.
yes.
So what else are we talked about the follicle stimulation. You know what, though? I think one of the common things that I hear is people freaking out when their heart starts to beat fast. Like you just have that anxiety, out of control feeling.
Like a little palpitation.
Yeah. Do you know what I'm talking about? Like, I think commonly it comes with a hot flash, but sometimes it doesn't. But you get that anxiety feeling and your heart's beating really fast, and that's also normal.
Mm-hmm. It is.
And what can we do? I guess breathing. Like, what can we do to help calm that down? First of all, it's going to help you calm down to know that it's normal. You know.
Mm-hmm.
But is there anything else that we can do, like cold face cloth? Like,
just hearing this, listeners will also calm you down, knowing that this is normal, and that is huge.
Yeah.
So again, looking at what evidence supports cognitive behavioral therapy techniques. So working with women through their anxiety, working through the impact that their menopausal symptoms are having on their day-to-day life is very helpful to decrease how much impact they will have on their day-to-day. And
but in that moment when you're feeling anxious, and even if you realize, hey, I'll be okay, but right now I'm like super anxious. I don't know, a glass of water or just
those deep breathing exercises, mindfulness.
And self-talk, right? I'm going to get through this. This is going to be temporary, right?
It's almost like when you walk yourself through a panic attack.
Exactly,
right?
yeah.
So,
what works for you?
know that you're not alone.
That's right. And that this is okay.
Yeah, and it's common.
You're going to get through it.
Yeah. So whatever you need to talk yourself down or calm down.
Music. What about music? Even putting your headphones on and some nice
podcasts.
Ask moms today. I did have one friend who, when she would have her hot flash, she would have them so bad she'd like drench the sheets every single night and more than once. So she must have had to really keep hydrating too, because that's a lot of liquid. But also, when she would have them, she would have the heart palpitations. So that really freaked her out too. So and then that makes you more upset and you're freaking out. So it's
and there are lots of prescription medications that can also decrease the rate of those hot flashes. So there are women who, based on family history, let's say of blood clot disorders, or have had breast cancer and have been told they can't have hormone replacement. There are other medications that have been shown to be very beneficial for decreasing hot flashing. Some of them are SSRIs and SNRIs, which are two classes of antidepressant, anti-anxiety medication. So they work on hot flashing, but they also work on our mood and anxiety. So they can do double duty and definitely make a difference, as well as gabapentin, which is another medication that works on the nerve-based pathway that triggers hot flashing. And again, is very beneficial.
Wow.
Yeah. So there are other things
So
out there
much.
besides hormone replacement. And there are some women who just feel that their individual risk is too high, that they prefer to avoid hormone replacement. We've come a long way with other medications as well.
wonderful.
Yeah.
If you've had a hysterectomy, do you still go through menopause? Like if you have nothing?
Yes. Yeah. So the worst menopause are usually the surgical menopause. So someone who's had their ovaries removed for whatever reason, they go from having estrogen one day to not having it the next. It's very uncomfortable,
Yeah.
right? So we definitely want to help that woman through that transition.
So
That's
a lot of
interesting.
information.
Yeah. Oh, my
It's a very
goodness.
complex topic.
Yeah.
Yeah.
So I'm thinking that, in summary, if you have extreme symptoms, there are different options for you.
Absolutely.
And to go and see your doctor, a medical professional, and they can help you work through that. What's best for you is based on your history, your symptoms. It's very important to meet with your doctor.
Or nurse practitioner.
Or nurse practitioner, thank you. And just know that you're not by yourself. Like, calm yourself down, just understanding that all these symptoms, are very, very common. And we just put a list here, and you can, Dr. Tina, you can, comment if you want, but avoid triggers like hot drinks, spicy foods, alcohol, and stressful situations. They can all be triggers. Like Kim said, exercise regularly, yoga.
Weight-bearing activity exercises too, right?
Yeah.
Because we don't want to lose all our muscles. We
Yeah.
want to
And our bone mass.
and bone. Yes.
And bone mass. Yeah. And I really
Ooh,
do
yes.
like, I go to Aqua Fitness. So, and I'm thinking hot flashes, that cool sensation all over your body, to me feels good. And you're exercising, you actually are exercising too. Eating a balanced diet. And actually, you said this, Dina, fruits and vegetables. And what you had said, people that eat less meat and sugars.
Mm-hmm. Have been shown to have less hot flashing.
Yeah.
Mm-hmm.
So there's clinical studies done on that.
Worth it.
Yeah. Worth it. Not worth it.
I know chocolate's kind of.
I know chocolate's my thing.
Yeah.
But yeah. Anyway.
And things like quitting smoking, and,
Yes.
that's also going to just decrease your risk of heart disease, stroke, and other health problems too, and menopausal symptoms.
Mhm.
So you know what, really, this is just all beneficial for us, and it's really just yay you. Look after yourselves. Be good to yourself.
Mhm.
You deserve it. You're important. Any final comments or suggestions for all us gals, Dr. Tina?
Well, I think exactly what you pointed out, right? It's very important to be aware and do that self-care. And that's one of the things that we find that in that age group that goes through the menopause is that we're often that sandwich generation, right? We have caregiver roles for young children potentially at home, as well as elderly parents. And we have a lot of stressors. So it's really important to do the self-care. I agree with you.
Yeah.
Amen.
So action item. First and foremost, please take a few minutes for yourself each day and try to remember in those anxious moments that menopause is a natural stage in a woman's life. If your symptoms are unmanageable, again, please seek help from your medical provider. They can really help with different options that'll work.
Thank you from the bottom of our hearts, Dr.
Yes,
Tina.
thank you,
My
Dr.
pleasure.
Tina.
And we hope you come on again.
I hope to.
Yay.
So thank you so much for sharing all this great information, and to all of you out there for tuning in, and for all you going through all this. You got this. And thanks again, Abby, for the great suggestion.
Yes, thank you, Abby.
We hope you all feel heard, supported, and empowered, and we know you're doing your best.
Yes.
If you have any questions or concerns or topics, please send them in to askmomstoday@gmail.com.
And please remember, you're not alone. You're never alone. So until next time, take care of yourself.
You've got this.